Welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and let's look into the latest developments from the world of medicine. Calcitriol and Sirolimus combination found to be effective in treating chronic primary immune thrombocytopenia. Primary immune thrombocytopenia is an acquired autoimmune disorder affecting both children and adults, and it is characterized by a low platelet count. The low peripheral blood platelet count is often caused by premature platelet destruction, by self-reacting antibodies, in addition to an impairment in the platelet production. Now, the disease is heterogeneous in its pathology and clinical features, and also even the responses to treatment. According to a recent study, the researchers revealed that the overall efficacy of calcitriol when it is combined with sirolimus in the treatment of immune thrombocytopenia in adults is satisfactory, which can effectively elevate the patient's condition, improve the quality of life, further increase the platelet level, and also decrease the expression of vitamin D receptor in the peripheral blood lymphocyte. Visual outcomes, complications, and refractive results of cataract surgery now revealed. Cataract surgery is always challenging in short eyes with increased complication rates and poorer post-operative refractive predictability. Cataract surgery in short eyes is surgically challenging with a higher risk of intra as well as post-operative complications. A study in the clinical ophthalmology found that the majority of cases resulted in improved vision and were uncomplicated. The study results supported recent studies that cataract surgery in short eyes, including nano-ophthalmic eyes, is safer than the first reported. Challenges in short eye and nano-ophthalmic cataract surgery, however, still remain. Complication rates are higher than in non-ophthalmic eyes, and post-operative refraction is much more difficult to predict, even with the availability of multiple and new intraocular lens formulae. Dermoscopy can help diagnose acrokeratosis verruciformis, obviating the need for biopsy. Acrokeratosis verruciformis of Hopf is an autosomal dominant genodermatosis. It is caused by the mutation in the ATP2A2 gene. Both the conditions as well as the Darrier disease are believed to be allelic disorders. Familial cases of acrokeratosis verruciformis of Hopf usually have early onset either at birth or childhood, while the sporadic cases usually present later in the life. Recently, a study in the Clinical and Experimental Dermatology Journal revealed that the dermoscopic examination using polarized contact dermoscopy revealed structureless skin colored to yellowish areas with whitish dots and streaks. Some papulas, especially the larger and the less keratotic lesions, showed uniformly distributed dotted vessels. To conclude, dermoscopy can be helpful in diagnosing acrokeratosis verruciformis of Hopf and may help to eliminate the need for biopsy for diagnosis, but robust studies on the diseases are still required to finally arrive at a conclusion. Drug combination may help young patients with chronic lymphocytic leukemia in remission for several years. Young patients with chronic lymphocytic leukemia can enjoy long remissions on the drug ibrutinib, but must stay on it indefinitely to keep the cancer in remission stage. A new study suggests that a 2.5-year regimen involving ibrutinib and chemoimmunotherapy can provide deep and lasting remissions of the disease. Patients with lower risk chronic lymphocytic leukemia, which is marked by the mutated IGHV genes, can gain long remissions from a 6-month regimen for the chemotherapy drugs fludarabine and cyclophosphamide and antibody therapy rituximab. Authors concluded that this therapy has the potential to generate long-term remissions in the broad population of younger patients suffering with CLL. For young patients in particular who hopefully have decades of life ahead for them, the prospect of a time-limited therapy can have durable impact without the need for ongoing treatment is very impactful. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.